That's nice music, ain't it? I don't know. Can y'all hear that music when we do the countdown? It's like a cool out type of music. Alrighty then. So what's going on? So y'all know it's 6 o'clock, and we got to finish up with the medical billing class. This is the medical billing class 11. 11. So those of you who have been hanging in there, just make sure that you stay on point and number your classes. This is class number 11. We are in medical insurance billing, and we are starting today with 11, 12. Is it 11, 12, and 13, or 12, 13, and 14? You guys already went over the reading material as far as the coding is concerned. So what we are doing today is going over the workbook involving the coding. Okay. So you guys remember I told you to check out Kindle, because Kindle may have the CPT book where you can kind of get a sample on it. Okay. I'm going to put this up because this one is regarding your class right now. So this is a medical billing course. If you guys are on the street, or if you're at home, or if you're in the backyard, and you want to kind of go on and you don't have the QR code to get into the classroom, this is how you get into the classroom. It's Sapphire Education 4309 with one E. Okay, so with that being said, you can go through with your phone, you can go on your iPad, however you need to get into the course, just get into the course. Because the way you get into it from YouTube is so easy. I don't have anybody saying that they have any issue with getting into YouTube. Okay, so yes, this is the YouTube University Medical Insurance Billing. Those of you who do not have your books, y'all know what I'm getting ready to do. I'm getting ready to put the books up, because I need y'all to make sure that you get the correct books. Okay, so but we're just going to go over this real quick. So this is medical insurance billing that we're doing right now. Okay, I'm going to drop this down. Your next course is going to be your medical coding course. Okay, that is the medical coding course. Well, that's not the next course. That's your core courses. Okay. Um, After we finish with showing you how to do the coding, uh, what the coding is, the ICD-10, the CPT, then you go into your core courses. But your training medical coding course will be after this one, and this one is pretty much your medical terminology. All right. So this class actually has 3 courses. Okay, 3 courses in this class. Okay, right now we are working on your medical insurance billing course, and that's this one. Okay, so with this course, you need to have your medical insurance billing book. And this is for like new people who have come in that want to join the class. And they haven't seen, what kind of books that we use. As you guys know, we go over this all the time. And every time we start, we pretty much go over this. So let me go ahead and put it up. So what we're looking at, let me just take this down. I don't know, where is it? Let's take this down so I can put this up and show you guys this. So these are the books. Okay. Elsevier, evolve.elsevier.com. That's where you're going to get your books from. Okay. Those of you who do want new books. Okay. Now you can get the older version. That's fine, but not the CPT books, ICD-10 or HCPCS, because if you're taking your coding exam, I want you to have new books. Okay. You have to. Well, you can get the year before. Okay. You can get the year before. All right. So let's take this down, and then we're going to put up the books that you need for the full course. And this is for the full course, the books that you need. Your CPT 2025. Here is the ISBN number. Your ICD-10-CM 2025. Okay, ISBN here. Your HCPCS level 2, ISBN here. Okay, not sure what that is. That's just a blank page. Okay, so this is what we are working in right now. Your medical insurance billing book by Fortney. Again, there are sites that have these books cheaper. Definitely we check Amazon.com. Check Amazon at 4 o'clock in the morning. They may have these books. Okay, so we're not going to do a long drawn out of the books. We're just going to kind of keep it moving. This is how you learn how to do coding. You can learn this on your own. We are here to give you guidance. We are here to give you guidance and put you in the right place. Uh, this is just like a real school. I've created this course just like as if I was in the classroom. I want you guys to follow it, do diligently. Okay? This is a language of medicine book. You will need this for the next course. Why, Miss Lambert? Because the next course is medical terminology. That's why. Okay? Your next course is medical terminology. Okay, I cannot give away this book on YouTube because it is a copyright book. So we can't give that away. And don't forget that you guys who are new, and some of you are pretty much new to coding, uh, this is the medical insurance billing book for new people. Okay, yeah, that's me. That's like, I was in a class. This is, I don't know, like 13 years ago. I don't know how old it was. But I tell you what, my grandson is 19 years old now, so it's had to be at least 15 years old. Yeah, I've been teaching forever. But I've written this book for those of us who don't know anything about medical insurance billing and coding. I love this page. I'm kind of looking like that right now with this hairdo. But this is the medical billing and coding Q&A book. Don't forget, I have it in the chat. It's here. Okay, it's here. I haven't had time to post different things to these chats to give you guys a little bit more. But please just look through the chats and you will find everything that you need in this chat, especially if those of you who are doing this self study, because that's what this is. This is a self study. Okay. So what I want you to do is make sure you have your notebooks, make sure you have your pencils, your pens, your markers, whatever it is that you need to get through this class. Um, okay, so let me go ahead and move on. And again, you guys do not forget the class that we are in. What, Miss Lambert, is medical insurance billing? This is your medical billing course. Okay, and those are the books that you need for this course. Okay. Some of you who have just joined my class, please review some of the older chats. The chats are numbered, class 1, 2, 3, 4, 5, and that will help you along. Okay. I believe I was able to get the schedule up for you guys. So I'm going to go ahead and remove that. Let's see if we got schedule number 4. It looks like I got schedule number 4 up there. So you guys can take a look at this, okay? Take a look at this. Today is Monday, and you guys know I always kind of backtrack from Friday or Saturday what we did. So we're just going to kind of backtrack 9, 10, and 11, and then we're going to move on. This is for this week, okay? So you got 12, 13, and 14, ICD-10, CPT, and HCPCS. Okay. If you guys are looking at this on your phone, might be a little bit difficult. You might have to just kind of make it bigger. But this is your schedule for this week. Okay. So you guys remember the beginning, I had a Tuesday in there, but that's because I had put that in there by mistake. So that's why we had an extra class. Okay. Classes are Monday, Friday, and Saturday. And I'm trying to stay in that vote because my schedule has changed at work. But I think I'm still able to handle the 6 o'clock. If I'm not able to continue with the 6 o'clock at some point, I will have to do a video instead of it being live with you. I might have to do it random and then just let it come out at 6 o'clock. Okay. But right now, if you guys come in, I'm live. You guys can ask me any questions that you want. Make sure you send me a message, subscribe to my channel, and please like. Okay. So again, 9, 10, and 11, we went over that already. Only thing I'm going to do is kind of backtrack for some people who kind of missed that class, and then we're going to keep it moving. Again, this is your schedule for this week. Okay. Now, in this classroom, you guys don't have that many classes left in this classroom. I'm going to go ahead and remove that. I think there's 4 classes. So today is class 11. You have today is class 11, so you should have a couple of classes left. Let's put this up. So You actually have 12, 13, 14, 15. Okay, so you got 4 classes left for medical insurance billing. And that means that we have concluded both books in full, the reading book and the workbook. And again, if you guys have any trouble, let me know. Send me a message. And this is for the Sapphire students too, because you guys should be cluing in on YouTube. I'm going to do a rundown tonight with everybody to make sure you guys are cluing in on the YouTube. I haven't had a chance to do it yet. I've been so busy, but I'm okay to get you guys on that new roster. So there's a new administration that you guys are going to click with. I'm going to say that tonight. But so class 12, 15, 16, 17, 13 is chapter 18. I got 18 twice. It should be 18, 19, and 20. Chapter 14, 21, 22, and 15 is your capstone. Capstone is everything that we did. So that's what that chat will be about. Okay. So if you guys want to take a look at this, you can. And don't forget, that's a typo there. It's supposed to be 19. Okay. No, I can't fix it now. It's just too late. Okay. Well, it's actually not too late, but you guys just kind of take a look at that. So let me get in here, and I'm going to remove that, and we'll put this up. And again, you guys are looking at the medical insurance billing course, and I've already showed you guys the books because we go through the books all the time. I'm going to show you your schedule. Yes. Why, Miss Lambert, you showed us already? Good, I'm going to show you again. That's your schedule, okay? This is what you should be learning in this classroom. This is what you should be learning, okay? So this is your medical terminology. Medical terminology I normally do first, but I've not done the medical terminology first here because you guys don't have the medical terminology book. My students that are physical students that don't have their medical insurance billing book, they can start on medical terminology until they get their medical insurance book. Okay, so these are the classes. You guys can kind of do a rundown on that. Those of you who are in the classroom, this is how we do it. Just kind of go over what we already went over in the classroom, and then we move on. Okay, so we did the books. That was for the last class, and that was for your slides tonight. I want to put this back up here. Okay, so what I'm going to put back up there is just your schedule, just to make sure that you guys can get a look at the schedule. So this is your schedule, and you guys remember I told you about the course physical schedule to keep you on track. It's this physical course where you just check off. You check off what you're doing so that you are not repeating the same thing. Okay. In this course, as you guys see me do them on YouTube, I'm trying to make sure that you guys are not repeating the same thing. I don't have my extension for my tabs. I'm calling them tabs, but y'all know I'm blank right now. I don't know what I call them, but I need to put some of these in there because I wanted to show you something. But it's okay because I need to make sure that you are on track. Don't skip any chat. That playlist, let's take this down. The playlist that you guys see in there where I'm building 70 chats. I've got over 400 chats. You don't need to just look at those. But this medical insurance billing class is in that chat. Everything will be in that playlist. The next playlist that I'm going to build is the medical terminology playlist, and that playlist will have the classes that we're going to do in there. Same thing. It's going to say Sapphire, ED, CLS 1 or 2, or Sapphire, CLS, MT 1 or 2, just to keep you on track to know that's medical terminology. Okay, so that's what will be on the top of on the beginning of the chat. What do you call those things? Thumbnails. Okay, so we're going to go ahead and get right into it. I haven't shared my screen yet. I'm going to share my screen with you guys just to kind of give you insight on what we have already went over. So you guys do know that we are still in the workbook. We are in the workbook, and we've already went over these sessions. And again, you guys know when I go in, I try to backtrack so you guys know where we're at, and especially for some of the new students that might be with us. Okay, let me go down. So this is where we are, and this is just a recap. This is just a recap for this, okay? But generally, your class 11, we're going to talk about the coding in this class. And we're kind of behind a little bit because I was away for a week. Okay, so I was away for a week on this, but this is your class 11. And those things that we're going to go over are the things that I just showed you. Okay, so that's the workers' comp that we're going to go over. Now, some of you already did the workers' comp and that schedule. I think I probably need to fix that schedule because it looks a little bit confusing to me. Um, the 9, 10, and 11 that we go over, I don't normally put it actually on the schedule. We just pretty much go over it. But I'm gonna fix that schedule, so don't worry about it. Then you'll still be on point. You'll still be on point. So with that being said, so that was 9. So when we did the workers' comp, we already did it in the reading. So you guys were only doing it in the exercises. Make sure you do all of the exercises. I prefer you do all of the exercises because that's how you're going to retain the workers' compensation, the key terms. Okay, I'm gonna take that off. So that's how you're going to retain those things. Um, the key abbreviations, especially the abbreviations. I'm just kind of backtracking and looking at workers' comp. Okay, those key abbreviations are a total must. Okay, I want to make sure you look at those. 10, disability. Okay, make sure you check that out. Okay, now you already did the reading. The only thing y'all doing is the workbook for that. Okay, we're just backtracking. 11, medical documentation, electronic health record, key terms, acute, backup, chief complaint, chronic condition, clinical documentation. We've already gone over this. That was last week. Okay, so what you guys are doing this week is what's in your workbook. What's in your workbook? And remember, if you do not have your book and you want to get the new book, I want you to make sure that you go to Elsevier and get your book. Okay, go to Elsevier and get your book. Do not buy 12 books at one time. You're going to have to get the 2 books, the workbook and your reading book. Okay, the workbook and your reading book. I'm gonna put it up just in case. Just in case y'all missed it. That's your workbook and your reading book. That's what you need for this course. Okay, this is an archivable course, so don't forget what you're supposed to be doing. If you get lost and you come in on chat 12 and you forgot, go back to that playlist and go to chat 1. Totally forgot what Miss Lambert said. What is she talking about? Go back. If you're still lost, send me a message. Okay, send me a message to get you back on track on your medical billing. Okay, so those are the books that we need to use in the medical billing. Okay, and again, I'm just kind of backtracking. Okay, medical terminology is your next class. Okay, you guys got 4 more classes after this. Okay, we just backtracking on your workers' comp that we did last week. So do not forget. When we get ready to get into terminology course, that's when you're going to need that book. Okay, that's when you're going to need that book. But I wouldn't worry about it. Just make sure that you follow. Once you're okay to follow what you need, you'll be okay. Let me go ahead and put that up. I need to let you guys know that we only have 4 classes left. Okay, we got 4 classes left. Okay, so I'm just pretty much backtracking over 9, 10, and 11. All right. So your schedule that you have right there to have that 9, 10, and 11 on it, it's okay. We're just moving ahead. All right. Because that 11, 12, and 13 was your Friday, but I'm going to change it. Okay. But it's the same thing. We're doing it in the same week. All right. 15 is your capstone. What's capstone, Miss Lambert? Capstone is us going over everything. Y'all know I'm always, every time I sit here, I think I have everything. And I'm looking for the schedule. I'm looking for the schedule, and yeah, I know I'm gonna beat myself up for not having the schedule right in front of me, because I wanted y'all to see the regular schedule that my regular students use, and that schedule keeps you on track. But I got good news for you. That schedule is inside of a chat. All right, go through. It's not in a playlist. It's in one of the older chats. Okay, it's in one of the older chats. And don't forget, if you guys have any questions, make sure you send me something down below. I usually at some point end up going over all of my chats. I know it's time consuming because it's always something that I want to fix or I want to change or I want to add. Like this one, I got to go over this one at some point, and then I'll put the pin there. They keep telling me to wear the headphones, because I might be fading in and out, but I can't put those things on my head. I just want to make sure that you guys can hear me. I turned that other light out at the back because I saw some type of something glowing up there. Okay, but again, that's what the capstone is. Y'all know I get thrown off. All right, so let's move on. All right, so that is your capstone that we're going to do at the end of your course. Okay, so that was 9, 10, and 11. Okay, so now don't forget, we're in the workbook. We're in the workbook. You guys already did the reading. This is the workbook that you are doing. So you guys remember when we did ICD-10 in the reading book. You are now in the workbook. So everybody should be ready to do the workbook. Okay. I'm going to backtrack and see. I don't think this is going to let me put that. All right, let me take this down. I'm going to see if I can jump over here. I have my CPT book, but it is, sheesh. I'm trying to see if I can let you view this book. I'm not supposed to because this book definitely has a copyright on it. But it's a big difference from looking at a book um, from an ebook than a physical book. Now, this is from Kindle, and I wanted to show you guys how you get the free version from Kindle. Let me see if it'll let me do it. Yeah, y'all know I'm not savvy with this, but I'm gonna find out right now. I'm gonna stop the share on that one, and then I'm gonna see if I can share this one with you guys. I don't know how to do it. Let me see. Let's see. A window, a window. Oh, I think I got it. I don't know. I think I got it. I think I got. Y'all tell me. Y'all tell me if y'all can see this. Okay, wait a minute. Wait a minute. Wait a minute, y'all. I got it. This shouldn't be a copyright because it's in Kindle. So why should it be a copyright? But let me. It's free and it's in Kindle. But this is the CPT book I just wanted to show you guys. So you guys should be able to see. See, this is Amazon. Okay. Now because I got to toggle back and forth from Google to whatever that other one is. Okay. This is Amazon. But this is what I wanted to show you. Look. You see that? See that down at the bottom? Read sample. That's what I was trying to tell you guys. If you don't have your book, you still can look at the sample. Now look how many pages. Look at this down here. Now I know some of y'all don't like the E version, but I've kind of gotten used to E version. Look, category 3 codes. I've kind of gotten used to it. So, that's why I'm kind of used to it. Before I know I hated it too, but I did get used to it. I'm going to take it down. I did get used to it. But do you see how easy that book is on the Kindle? I look at a lot of my books on the Kindle. Well, all the rest of the books I have Elsevier, but I did have to go to Kindle to get my CPT book. But you guys that are taking the test, you have to have physical books when you're taking your test. But I'm just kind of giving you the idea of how the Kindle works and how you can get all sorts of books from Kindle, the first few pages as a sample. All right, so whew, I gotta stop the sharing on that. Hold on. Okay, so I'm gonna stop the sharing on that one because I need to share this one. Okay, y'all know I'm still trying to get used to this thing here, but this is the one. that we're going to work on right now. So that's your ICD-10. Now, I can't have it up the whole time, but you guys know on your ICD-10, you already did the reading. So now you are doing your ICD-10 exercise workbook. Okay, your key terms are the same: adverse effect, benign tumor, carcinoma, institute. Okay, this is what you should have read. Chief complaint, combination code. I'm gonna drop it up there for 1 second because you guys already seen it. Your chief complaint. Let me tell you something. Make sure you understand what the chief complaint is. If you do not and you are not clear on what you're reading, make sure you come and ask me. Okay, I told you guys to make sure you put this on your index cards. Remember, this is the workbook that we're going through now. We already went through the reading because you guys should have already read this, right? So now it's time for you to start doing the reading. Excludes one, excludes two, because we're in ICD-10, right? So I'm gonna pull this one up. I don't think you can see it unless I do the share. So what I'm gonna do is I'm gonna stop the share from that one so I can show you um, share screen. You guys remember that guidelines I told you to look at? Now this is for public, so we can kind of keep this up for just a second or two. Hold on. Yeah, the mic is driving me nuts. Okay, so you guys are going to type in, cms.gov XYZ. I don't know why I only have one bar up there. I'm gonna smack somebody if you guys can't hear me. I know, God forgive me, I ain't mean that. Okay, so those of you who don't have your book, y'all know how I did. You don't have your book, go online, cms.gov, and tell them to give you the coding guidelines, okay? If you do not, I'm going to switch over so I can move it down. If you do not have your ICD-10 book, this is free, okay? But don't forget, don't sleep on Kindle. This is free. If you can't do this chapter because you don't have your book, I suggest you go to cms.gov, okay? 2025 ICD-10-CM guidelines, okay? This is what we will be going over. And you don't have to worry about putting out a whole lot of money for it, okay? You don't have to put out a whole lot of money for it. And again, we're just making sure that we kind of backtrack over this because this is what you need to do. Essential modifiers, etiology, late effects, laterality, malignant tumor. These are the things that you should have read. And in the workbook, it's so much fun because you're basically going over what you just did. AHA, AHEMA, CAC, CPT, DM. In this classroom, what we're doing is putting you in the right place. Okay? If you have a question, please feel free to ask us. You are not sure what they're going to have on your exam. Okay? Go to AAPC.com and you can see they give you like a little list of what's going to be on that exam. So don't think you can just do a class and you don't know. AAPC gives you a lot. When you get ready to get your ICD-10 book, get the AAPC version. Get the AAPC version because that is what your test is going to be derived under. Okay, get that AAPC version. Okay, so I'm gonna add that to the stage because your coding course that you're going to get ready to do. This is just a small portion. Now, generally, you guys know I took that out of your class. I took it out and I just added it with the core classes. And the reason why I did that is because I didn't want you to get confused with medical insurance billing. Okay, this course with the front of the medical coding course, I'm very tempted to use this as your thumbnail. I'm going to use them as your thumbnails. I have changed thumbnails before. I love this color of the thumbnail of the YouTube University, and I think I'm going to use it. But on the coding course, I'm probably going to drop this up there today. I don't want all of my thumbnails to be the same. So that's the reason why I just made just for the inside. But we're definitely going to use one for the outside. Okay, so let's get back to what we're doing. Okay, so AHEMA, NEC, NOS, and again, That's going to relate back to your guidelines in your ICD-10 book. That's going to relate to your guidelines in your ICD-10 book. I'm going to just kind of go over this, your study outline, diagnosis, coding, overview, international classification of diseases. This is in those guidelines that are free. Organization and format of the ICD-10. Something like that will be on your exam. They may ask you, where did it originate? Where did ICD-10 come from? You're not a genius. Nobody did make this stuff up. Everybody's reading it from a book. That's where you're going to get your answers from. Just like in your medical insurance billing book, you're reading it from a book. Okay. And that's where you're getting your answers from. AAPC did not make up this stuff. They got it from the book. They got it from the CPT. They got it from the ICD-10. They got it from the HCPCS book. The goal is to see how much you studied that ICD-10 book. Okay, see how much you studied the ICD-10 book. I'm keeping this up because I'm going to stroll back to Safari because I want to see if I can get to the coding section. And look at this. I got to show you guys this. I know it's going to be a pain in the swamp for me to go back and forth, but I have to show you this. Okay, so okay, stop sharing. Okay, share. I want to show you this. Window. Ding. Bing. I'm getting the hang of this. Okay, so can you guys just see right here where it says instructions for use of the CPT book? Wait a minute. Instructions for the use of the CPT book. Can you guys see that? No. There you go. Oh, I gotta take that down and put this back. Okay. So instructions for use of the CPT book. This is not a copyright. They're giving this away, so they better not even try it. The CPT book, again, everything you learn about CPT and coding, you're going to learn it from right here. You're going to learn from this is the book. It's just in the e-version. You read the book, you could find out how to do it. Okay, but you have to have some type of a guidance to put you in the right place as it relates to how you're going to do the coding. Okay, how you're going to do the coding, application and submission. Criteria is 1, 2, and 3 codes. Category 1, Category 2, Category 3. See, it's telling you what it is because even though we're supposed to be on ICD-10, but I had to jump on this real quick. In your exam, it may ask you that. AAPC may say, well, what is Category 1? What is Category 2? It's all about study. Here, look, this is where it's telling you about the appendix. I'm coming back to y'all right now. This is where it's telling you about appendix. They may say, what is an appendix they're going to, because I remember that. Okay, they are going to have something like this on the test. Okay, but again, this is the CPT book that you're going to get if you choose to do your studying from your ebook. Okay, again, I got this from Amazon. We're not, sponsoring Amazon in any kind of way, but this is Amazon, and my medical billing and coding Q&A book, you also will get this from Amazon. But I mean, look at the price. It's the same price as the regular book. I mean, you can't do any any coloring or highlighting in there, but at least you can, get an idea of it. I love this right here. I'm coming back to you guys right now. Look, modifiers. This is how you learn about modifiers. You read and you learn. You read and you learn. That's how you learn. Okay. I'm just going to take this down, and then I'm gonna stop the share. Then I'm gonna go back to my other screen. Okay, so we're generally we're in the workbook. The workbook is for these medical insurance and billing. We are looking at chapter 12, ICD-10-CM coding. Okay, and you guys are going to go over your guidelines, and your guidelines is going to tell you where this is and what it does. What is a placeholder? What is excludes notes? Excludes notes, includes and excludes notes. Sorry. And with C and C also. Okay, gender, and age codes, chapter specific with neoplasm, circulatory system, respiratory system, pregnancy and delivery. Your whole course is derived of that. When you I'm gonna put it up. When you guys get ready to get to your core courses, that's how I made my course according to the CPT book. So that's how you learn to code each part of the body. Okay. So again, I'm gonna take that down and put this up real quick. These are the classes that you have left. Okay, in the medical insurance billing class. These are the classes that you have left. This is the class that you're going to be in next. Hold on, let me make sure I got it right. Medical terminology. Boom. Okay, medical terminology. Let's get rid of that. This is the book you need for medical terminology. Um, Try a different site, thrift.com or something like that. You may get this book for like $6. It does not have to be a new book. Language of medicine, either one. Okay, either one of those books is fine. All right. Let's add that to the stage. Okay. So now in the workbook, remember I said when you guys are doing the workbook, it is the same thing. Okay. Every time you do it, it's like repetitious. So don't forget, we already did the reading. It's time for you to do the exercises. Review the questions. So this is how you're going to review the questions. It's pretty much you're going to fill in the blank. But you guys have this already. So those of you, if you don't have your book, it's going to be impossible for you to do the class if you don't have your book. Because again, I can't put that one up there. Oh, hold on. Let me put it up there for you guys. Let's take this down so we can go ahead and put this up here. So you're going to need the books. I mean, it's a free course. YTU is YouTube University. The only thing is you have to purchase your books. You do. You have to have your books. You guys can follow me along as I'm doing, but there's no way you can do the exercises without the book. Okay. All right. So let's go back and let's go back because we're doing the coding right now. So that was pretty much your fill in the blank. Okay, the neoplasm table has column headings for what? In juvenile diabetes, the patient's blank does not function and produce enough of insulin. When coding for diabetes in pregnancy, a code from category blank is assigned as a primary code. This is so much fun. Okay, so that's one portion. Okay, and we've already went over this. Part two is your multiple choice. So when you are in the the workbook, the format of the workbook is the same. So whichever chapter you finished in your reading, let's say it's ICD-10, and now you're getting ready to do it in your workbook. The format is the same. You have the fill-in, you have the multiple choice, and you have another section. I think it's a summary section. I'm not sure, but they're all the same section. However it is, it will still give you insight. You have to keep in mind that you will have some of these questions on your coding exam. So there will be some medical billing on your coding exam. Okay, so let's see what that third section is. Okay, so this is multiple choice. Annual updates to ICD-10 are published by the multiple choice A, B, C, or D. The alphabetic index to diseases and injuries is placed at the volume one. I gotta show you this because see, this is how they trip you up when they start telling you this stuff like this. Let's take that to the stage. Oh, why is not let it come down? I don't know which one it is. That one? Remove. Okay, so I'm gonna put this up because I want you to see this. So you might not be able to see this unless you guys are home. Look, which one I was looking at? This one. Annual updates to ICD-10 CM are published by the AMA and AHA, AHA, AHIMA, AHA, AHIMA, U.S. Printing Office, AMA, AHA, AHIMA, U.S. Printing Office. See, those are trick questions, but the answer is in this book. That's not the one I was looking for, though. Which one was I looking for? The one that I was looking for, I can't find the one I was looking for, but you can see what I'm saying. The equivalent of unspecified is A, NEC, B, NOS, C, non-essential, D, secondary. This sounds like I'm in the test, like I'm taking the coding exam. You are going to have that question on your exam. Do not sleep on the CPC. This book is, you're going to have to get this book. Some of you who are looking at this on your phone, try to make it bigger so you can see what I'm showing you, because I can't generally have it up too much. But in the medical coding, what you learn in the medical insurance billing book will be on your exam. Remember, there's sections on your CPC, and they're open and close sections. Let me put that back because I want to show you what the open and close section is. This is called open and close. That's open and close. When it's multiple choice, that's when it's called open and closed. Okay. So again, we're looking at chapter 12, and we're just going through it real quick because okay, so this is what we was talking about. What the other part was. Part 3 is true or false. I'm gonna show you what it is because we looked at it already. We know what it is. Part 3 is true or false. Part 3 is true or false. I'm just adding that to the stage just so we can have something up there. So just make sure when you study, make sure you have your index cards. Make sure you have these all over the place. You guys know I have them all over the place. Make sure you have those so you can keep up with what you're doing. Um, we are going to have, again, I'm just kind of go over this so I can let you guys know what's next. In your workbook, there are more chapters there because it's different. In the reading book, it says Unit 1, Unit 2, Unit 3, but within those units are the chapters. That's why it seems so short. When you get to the workbook, the chapters are longer because that's where you're going to do the work. Okay? So again, the capstone is when we're going to go over everything that we went over and in the medical insurance billing book. So that would be your capstone. Okay. So when you get to the bottom, I'm not going to show you that because you don't. Well, let me see. Bacterial meningitis. Let me show you this right here. Bacterial meningitis. They're showing you right here. I gotta take this down. They're showing you excludes one. Okay. Now you're gonna learn about excludes one. Where, Miss Lambert? Stop the share. Where are you gonna learn about excludes one, Miss Lambert? Right here. If you don't have your book, this is where you're gonna start. I want you to start right here. Okay, that's that CMS.gov where you can get those guidelines for free. And even if you got a thought about maybe I want to do the coding, maybe I don't want to do the coding, take a look at it. This is the start. The guidelines. AAPC wants to see if you have gone over these guidelines. I have read the guidelines a million times. You have to keep reading it and keep reading it until this stuff comes second nature to you, and then you start breezing through. You start breezing through your exam. When you get ready to take your y'all stick with me till this class is finished. When we get to the core courses and you get ready to start taking your pre-test, when I start giving you those pre-tests and they start coming to you second nature, you know exactly what to go to your coding book and look for. When we get to the coding section, I don't know if I'm going to use the 360 or what, because I can't show you that. Well, I should be able to screenshot that. I don't know, but we're going to figure it out when we get to that core course. Your next course is medical terminology, but in this little course right here, that's in the medical insurance billing book, I still want you guys to go ahead and do that because those free guidelines will help you. Okay, this is what I was trying to show you. I didn't put this up for you. All right, hold on. Stop the share. Now, when you get your book, When you get your book, you're good. It's going to show the same thing that I have in my book. Same thing. It doesn't have to be brand new, because you'll still have some of the exercises in it. You see that excludes one right there? Remember, there's an excludes one and excludes two. Don't get funky with this one. You see where it says includes? That's different than excludes. Okay, that's totally different. I'm gonna just move that down so I can put this back up there. Okay, I wanted to show you that that's inside that book. That is what this book is going to show you. Okay, GO2 meningitis and other infection and parasitic diseases classified elsewhere. And see, I'm gonna show you this right here. This is why I like the ebook. Let me get rid of that. This is why I like the ebook, because I can just show you what I want that's here. If I point to this, then okay, this is what I want you to go over. This is what I want you to read. Okay, give me a sentence with what that is. Give me a sentence with what this is. I can't see right off the back because I can't see from that screen, but I can see my screen. Okay, GO 3.0. Okay, non-pathogenic meningitis. Okay, GO 3.1 chronic meningitis. GO 3.8 meningitis due to other specified causes illness. You guys see where it says GO 2.3 where it's benign recurrent meningitis. It's not as invasive as meningitis unspecified, because he has meningitis, but we don't know what it is. I mean, that's worse than not knowing what it is. If you know what it is, then it's a lot easier for the doctor to pinpoint that. You know what I'm saying? When the doctor's tests come back and they give you a positive, okay, is this, then it's not that much worry, because now the doctor knows how to treat you. Well, not you, but you know what I mean. Okay, so but you see how when you start doing the coding, you get into it for hours. You get into it for hours. That's why I want you guys to make sure you set a space for yourself. Okay. I'm on figure 12.1. I'm on page 143 if you guys are following me. Number two, place an X in front of the following diagnosis. This is just diagnosis that they're going to have you looking for, and they pretty much want you to put the diagnosis in. That's not a problem. Okay, let me go in. So I can put this up for a second. Same thing. We're just pretty much going over the same thing. I just want to make sure that you guys are clear on what you're looking at. I don't know how the time just goes so fast. I'm already 47 minutes and we haven't even started doing CPT. I did show you guys a little bit of the CPT, but generally the CPT, I want you guys to make sure that you steadfast on it, the CPT, because that's the gusto of your test. I think the diagnosis you guys will get. I think you will get the diagnosis. The rest of it might be a little bit funky, okay, when you hit the CPT codes. All right. So again, no, this is your workbook. Performance objectives, tasks, same thing. A pregnant patient who is due to deliver in 6 weeks presents in the office with preeclampsia. And somebody tell me what preeclampsia means. A patient present with a chief complaint of severe episodes of pain and vaginal hemorrhage. The physician determines that the patient has an incomplete spontaneous abortion complicated by excessive hemorrhage. She was 6 weeks pregnant. Now, on your test, AAPC will ask you, there's a few different types of miscarriages. There's a few different types. And yes, you're going to have to read those because AAPC will give you multiple choice as to which type of spontaneous abortion is this. Is it a spontaneous abortion? Is it this type of abortion? Is it that type of abortion? So make sure you read up on all of it. That's why when you do your studying, when you do an ICD-10, these three right here, 12, 13, and 14. Is that what it is? Is it 11, 12, and 13? Y'all know what it is. Make sure you have all of your books, okay? Your ICD-10, your CPT, and your HCPCS. So when you get your medical insurance billing book, do me a favor, just try to get those three books. If you don't have them, and we've already passed this class, do not worry about it. You know you're going to go back to class 11. Why, Miss Lambert? Because this is class 11. Okay, these are your other classes. Okay, these are your other classes. Okay, so yeah, you need to have those books with this class. All right. All right, so let's just go ahead to CPT, and we did a lot of the CPT coding information. But again, this is just your workbook. This is your workbook. Don't forget your key terms: bilateral, bundle codes, care management, care plan, case management, comorbidity, comprehensive code. Yeah, you do need. I'm gonna put this up for you. You do need to be able to decipher this type of CPT wording, this type of CPT notes, this type of what is this CPC? Because if you cannot decipher this, you will not pass your exam. Okay, and it was such a dream to go over this book with you and show you the things that are in this book that you need to have in your possession to pass your CPC. These are the key abbreviations. When you have your physical book, write down what you need to write down. Okay. I can't have it up too long because, of course, these books are books that you are supposed to purchase to help you with your class. It's just like any class. The difference in this class is that you do not have to get a student loan. You do not need tap and Pell or anything like that. Even if you have taken a class and the class is free and you feel like you have not gotten enough out of that class, you can always come to this class, come to this chat. Make sure you subscribe to my channel. If you want to purchase individual courses and you want the tests that I give, you want all those different things, then you're going to go to sapphirecoding.com. You could either go to sapphirecoding.com or you can send me a message and I will send those courses to you. I'm not even sure how much they are now. I have to check with administration, but you can purchase individual courses. Let's say this medical coding course, you can purchase a medical coding course to help you. I give you additional tests and additional summaries, additional formats, additional theory. What you get here is theory, and you will do the practice. Okay, in the Sapphire course in my school, I give them theory and practice. You who are in YTU, YouTube University, you will have your own practice. Okay, that's why you need to have the exercise book. Okay, so we are now in the CPT section. You make sure you have your index cards, NCCI, FTC. We went over this. We're just going over this again just because this is the workbook now. You have already done the reading. Performance objectives. I'm gonna put this up here as far as the performance objectives so you guys can see what the objectives are and what you're supposed to be doing. So again, this is your small CPT section in the medical insurance billing book. We have not done the coding yet. This is just a portion that's inside your book. Okay. So again, this is your study outline. One, it is understanding the importance of procedural coding skills. Level 1, current procedural terminology, CPT, current procedural terminology, content and format. Your category 2 is performance measurement codes. Category 3 is new and emerging technology. When you read your CPT book, read it word for word. The purpose of the AAPC test is to see how well you have mastered the CPT book, the ICD-10 book, and that's going to consist of reading. Trust me, you're going to retain it. When you read something 2 or 3 times, you're going to retain it. Remember, those guidelines that are in ICD-10, if you fail the CPC, they're going to say she has not studied the guidelines. If you get to the open and close questions and you can't go boom, 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 and you spend more than 2 minutes on a question, it's going to mess you up from the longer cases. So that's why I want you to practice. Practice those open and close questions. You guys remember what I said, what open and close questions are, right? I'm going to show you what open and close questions are. I want to backtrack to them because this is what when you take your CPC, these are the questions that you're going to do first. This is what they look like. Okay, let me get right here. I'm going to show you in ICD-10. This is what they look like. I'm going to put you up. There they go. Okay, so here they are. This is what they look like. I'm gonna take this down just so I can show you. When you guys hear me say do the open and close questions first, you see how these questions look? I'm in the classroom. I feel like I'm in the classroom. Hold on, yo. I wish I was in the classroom. I could show you this bigger. Look, this is what we call open and closed questions. Read it, boom, answer it, closed. Next one, read it, boom, answer it, closed. Let me read it big. When a provider makes a hospital visit, the encounter should be reported with a diagnosis code that represented the boom, answer it, done, closed. You see what I'm saying? Done. Passage of which legislation in 1988 placed requirements on physicians to report appropriate diagnosis codes on all claims of Medicare. Affordable Care Act, health insurance, American Recovery Reinvestment, Medicare, catastrophic. Boom, answer it and you're done. That's what we call open and close. Open and close that in 1 minute, you just saved another minute for your case. Get a cardiology case, your chest is ripped open, and cranking it, you're going to need a minute for that. So that minute that you just got from that open and close question where you didn't waste a whole 2 minutes, you're going to use that there. So when you guys hear me say open and close, that is what I mean. You're going to ace your CPC. The open and close questions are to be done first so you can breeze right through them. So you guys know the CPC has been broken down to 400 now. It used to be 2.5, so now you only have 2 minutes. But the quicker you do it, the better. Boom, get rid of those. Remember what I said? Look at that 2-minute chat that I did. You got 2 minutes. You got 2 minutes to decide your next step. I'm talking about CPT too. So if you guys didn't see that chat I did yesterday, look at it. When you're in a bind, and something goes down and you're like, I got 2 minutes. You got 2 minutes to decide what you're going to do. That whole chat was really based on how I want y'all to do that CPC. But that's a chat of putting you under pressure. When you get ready to take your test, ladies, make sure you check that calendar. And it is not that time of I can't say the whole thing, but make sure it's not that time. I have had students on that day that just straight hemorrhage out. And it is because they nerves. So don't do it anywhere near that 7 days because it's nerves. And I had one student, she couldn't even sit still when the proctor came. When you take your test, everybody go up. I go with all my students because I don't want them nervous. She's looking at Karen's book, and Karen just, oh my God. So make sure you guys are good in that straight. But when you get to that 2 minutes, you got to make a decision. Okay, you got to make a decision. Right now, we're doing the medical insurance billing. But I want you guys to make sure that you understand the medical terminology. You cannot code procedures and not know about medical terminology. Why, Miss Lambert? Because you will not be able to decipher the cases, okay? So remember, we've only got 4 more classes. We got 4 more classes for this, okay? You must know terminology in order for you to code. Why, Miss Lambert? Again, you will not understand what the doctor is saying. Sometimes you got to correct the doctors. Don't be scared of them because my students, my billers are Miss Lambert. I have to go to the doctor all the time. I try to teach them how to talk to the doctor because you know how doctors are. Yeah, they can be nasty, but you just got to know how to, psychologically trick them. All right, so this is the medical insurance billing class. What is YTU, Miss Lambert? Is YouTube University. We got 4 classes left. So next class is your class 12, chapter 15, 16, and 17, 13, chapter 18. Now look, this is 19. They messed up on that. It's supposed to be 19. Okay, so that's class 13, class 14, and class 15. That's your capstone. Okay. So let's go back to, let's put that on the stage. All right, so the equivalent of unspecified is NEC. NOS, non-essential or secondary. So we did go over that, but I just wanted to make sure. Okay. So again, we just pretty much gone over 12, 13, and 14 just to give you that idea. This class is going over a little bit because we only have a minute left, but I still want to go over HCPCS just to kind of give you guys that idea. So again, you're going to need your HCPCS book as far as durable medical equipment. Okay. Yes, yes, this is going to be on your test. Let me pull this up so I can show you. Okay, let me get to that HCPCS book. There it is. So this is what you need. Okay. And do not forget, when you are taking your test, you can write in your own book. You can write notes in your own book before you actually take the test. Okay. So in this book, it has the same thing. Your key terms, okay? Ambulatory patient classification, okay? American Medical Association, uh, certificate of medical necessity. Medical necessity, as in why is the doctor doing this procedure? Durable medical equipment, Medicare administrative contractor, intramuscular. Those are shots. Those are shots. Okay, how are they getting their medicine? Intravenous. There are modifiers in here. And there's a section in here on Medicaid too. Section in here on Medicaid and Medicare. Okay, your key abbreviations: DME, BLS, EMT, FDA, HCPCS. Yeah, they're going to ask you. I'm going to show you these real quick. They are going to ask you some of the abbreviations. Okay, let's take that down. I have to remember to take down when we're doing. So this is the HCPCS book. They are going to ask you some of the things that are in that book as far as abbreviations and definitions. So same thing with the other books. The only difference between this book is you see how those lines are in there. That's where you're going to put your answers at. That's where you're going to put your answers at. If you have an ebook like I do, of course, you're not going to do that. You can put it on any kind of paper. Okay. Performance objectives in your HCPCS book. One, you're going to understand the code categories in the HCPCS level 2 code set. Define HCPCS terms used in HCPCS coding. Explain the types of codes found in HCPCS level 2. Okay, I'm not going to do the whole thing. Okay, HCPCS level 2 code categories: transportation, medical, surgical, and other supplies and services. I got to show you this part. I know I'm not supposed to, but I got to show you this part. Remove that. See? That's your HCPCS book. So you see how important the HCPCS book is. They're not going to have a lot of questions on HCPCS. They just need to know that you know how to find things. That you know how to find things in the HCPCS book, okay? Because it's going to be the same thing. Look, review questions, okay? Mix and match, multiple choice. Multiple choice is open and close. Y'all remember I said that. Okay, DME for Medicare beneficiaries is overseen by the table of drugs and biologicals list blank names. The following would not be reimbursed by Medicare as medical necessity: DME. A, motorized scooter. B, walker. C, oxygen delivery system. Or D, wheelchair. I'm going to show y'all that real quick. Maybe y'all want to get a look at that. Because y'all know the class is over, but when you guys archive, I'm just going to throw that little bit in there. So again, you guys should be doing your HCPCS book. You will not see me. Let me see what's at the bottom. Maybe I missed something. No, same thing, same thing. And look, I just want to show you this real quick. Let me show you this real quick. So I want to show you how some of the codes look. J0290, J3420. You can tell those are drugs. The J codes, you can tell are the drugs. Okay. I just want to kind of throw that in there real quick. Okay, so let me put that back on the stage. So that's pretty much the HCPCS book. You're going to do the exercises in those books. This is for YTU. YTU should be up on this part already and nothing else. If you are behind, I will not be back on this podium until Friday. So if you are behind, look at some of the other chats. The chats say Sapphire ED CLS 1, Sapphire ED CLS 2. If you missed class 2, go get class 2. If you missed class 1, go get class 1. We are already up to medical insurance billing class 12. So if you're new to my channel and you've missed it, we are giving a free medical coding class. We're giving a free medical billing class, and we're doing medical terminology. I am an instructor. I am director of the school, and I am giving this to YouTube University because I want to change world education. I'm giving you the same thing that I teach in this school. Look at some of my chats, and you will be able to see the type of books that you need to use. No, you will not be getting a student loan for this. I am so anti-student loan right now. I don't want anybody to get a student loan. I created the medical billing and coding program for my university, and I'm giving it to you. So there's nothing that's going to be left out of this program. I've given you this because I want to see people succeed without worrying about a student loan. If you have any questions, I want you guys to send me a message. If you work in a hospital already, send me a message. If you want to know how to talk to your doctor without him snapping at you, send me a message. If you want to find out about a certain type of code and you just can't find it, or you just can't decipher why would he use this code, or if you want to make sure, even if you have your Optum 360, even if you have your app for your coding and you're afraid to approach that doctor, we approach him. I'm going to show you how to approach him. You must be your surgeon's right hand, your provider's right hand, or your doctor's right hand, because when you're in a provider's office, it's much, much harder in a hospital. Because when you work in a hospital, my quotas are a needle in a haystack. When you work in a doctor's office, you side by side with that doctor. He right here, and send him something and change his code. And he coming in there, I'm telling you. Miss Lambert, trying to change my code. He right, I mean, you know he coming. So that's why I'm telling you there's a big difference from coding for a hospital, because they home. They home. They home. The doctors can't walk up on them. They better call me first before they call any of my coders that's working at home, whatever state they're in. Now, if you're in a physician office and I'm in there, when you do a physician's office, it's private. So they don't have the money to hire coders from all over the place. They don't have a coder that's right there with them. So when they have a problem, they can talk to those coders. That's you and your doctor, your coder, that he got to be your right hand. He got to be your right hand. If you're working in a doctor's office and you're working with one specialty, girl, you better have that specialty mastered. There's no reason any of those codes should kick back for up coding, down coding, something missing, unbundled. You should be par, because if you've only got one specialty that you're coding, you should be par. If you know that you only want to work in cardiology, you don't need to take the CPC. You don't need to master all 21 points of the body. Why don't you just do cardiology? When we get to the core courses, cardiology, I think, is the fourth course. You don't have to do all of my courses on YTU. I'm going to go over all 21 points of the body on YTU because I trained for CPC straight. I do tell my girls, go ahead and get the CPC straight if that's what you want to do, because what if you get tired of cardiology? What if Dr. Jones decides that he's going to go into another specialty? What if Dr. Jones decides that he's going to expand his facility and hire an OBGYN? So you as the coder, guess what? Dr. Jones, I know how to do that already. So he doesn't even have to hire anybody else to do that because you have all these different specialties. But if you know that you're only going to do cardiology, I wouldn't do the CPC. I would just do that exam right there. Why do you need to do the full 21 points when you're only going to do cardiology? It ain't cheaper. It's the same thing. But at least you know that you're going to focus on cardiology. This is what I'm going to learn. And I'm telling you, y'all know cardiology is my favorite. I have to show you the parts of a heart. I have to show you the valves. I have to show you certain parts, because on your CPC, you will have open and close function. Your lungs. Where is this? Where is that? They will ask you that on the CPC, but don't worry about it. This is the reason why I tell you guys to make sure that you study those illustrations in your CPT book. When I say illustrations, I'm talking about the pictures of the body. You guys, I'm gonna show you some right now. You guys remember when I told you guys, when you get your CPT book and your ICD-10 book, there are pictures in those books. And We're calling them pictures because it's human nature. You're going to call it pictures, but generally they are called illustrations. And illustrations are, they're bones, they're lungs, they're pictures of the body. I can't show that. Some things I can't show you all because listen, some of these pictures are something else. But you guys know what I mean. I'm trying to find a picture to show you that's not so invasive, but some of them are just ridiculous. I can't really show them. So just hang in there with me. I'm gonna show y'all one only because I want y'all to see what illustrations are like. And I usually use a medical terminology book to show you guys some of the illustrations that are in there. Um, we can do endocrine. Let's see what kind of pictures they got in there. See, okay, this is good. Look, I'm gonna share my screen with you guys so you guys can see what I'm talking about when I say illustration. These are in all of your books. Okay, don't forget you can write in this. This is what I mean by illustrations, pictures on your exam. AAPC will ask you, let's say it had at top of your head, they want to know what that is. Your cranium or XYZ, your lobes. They want to know what this is. And these are illustrations. Can you write in your book, Miss Lambert? Yes, you can write in your book. They do allow you to write in your book, but you're not going to have paragraphs and all that kind of stuff in your book because your proctor is going to look at your book. She's going to look at your book and see what's in your book. So you guys know that you can't put stickies in your book. My regular. These are what we call stickies right here. You can't put these in your book, but you can label your book. Here's another illustration. This is a good one. The large intestine and the small intestine. Look, this is going to be on your test. I'm telling you right now. They're going to ask you about the large and the small intestine. This is what you call illustrations. Okay, you see large intestine and they're giving you some type of descriptions in there. On your test, you will have open and closed questions pertaining to this because I tell you, it's almost like being a surgeon when you're taking your test. The hardest part about being a coder, like I told you guys, is taking your exam. That's the hardest part that you're going to do. I'm throwing this up because that's your next course, medical terminology, YTU University Medical Insurance Bill and Sapphire Coding. This is the next course in this classroom. There is no charge for anything in here. And I love to tell my students, go to a medical billing school, tell me what's in there. I'm the director of the school. There's nothing in there that they can't surprise me of. Your YTU course, your YTU course is ready for accreditation. I always made my school ready for accreditation, even though my school is online now. If accreditation came at me, we have our syllabus, we have our crosswalk, we have our theory, we have our practice. Theory is you guys reading. Theory is what we're doing now. This is class. Practice is you guys doing the workbook. Practice is you guys giving me the summary. The only difference between YTU and my school when you guys are online is that my girls, I give them tasks, I give them tests, they get quiz, they get competencies, they get actual cases that I give them. The YTU University, you guys don't get that because those are paying students. But you guys will need to do the CPC book. In the CPC guide, there are cases in there, and you will practice those cases. Just remember, coding it's not hard. It's a trade that you have to master. And remember these two things that I'm giving you. The ICD-10 has to be mastered. I'm showing you this because I don't want you guys to forget that this is free. Okay, the guidelines must be told. AAPC, can you guys see that? AAPC, look, that's the full guidelines. I'm gonna pull it up right now. Let's get rid of that. That's a full guideline. This is free. In your AAPC, they're going to give you questions. Remember, the purpose of the AAPC is they want to see if you have mastered the CPT, if you have mastered the guidelines, if you have mastered the HCPCS book. This is free. CMS.gov 2025 guidelines. This is, you see that up there where it says October 1, 2024, September 30, 2025. That's on your test. So you need to know that. They're going to say, when does the official guidelines come out? What is a year? This is our year. You know, like hospitals have their year from September to September or whatever. People have their year from January to January. This is coding year. So that's something like that is going to be on your test. But if you can't get your ICD-10 book right now, I would suggest that you get these guidelines from online. This is nothing copyright or anything because this is free. This is for the public. And these are the full guidelines. You must read this a million times. I'm exaggerating, but look what it says. It's telling you where ICD-10 came from, what it used to be called. The Center for Medicare and Medicaid Services, CMS, telling you what that is, and the National Center for Health Statistics, NCHS. This is what's going to be in your test. Tell me what NCHS is. That's what they're going to ask you. That's why I want you guys to make sure that you have your index cards and you put these things on your index cards. What's WHO, World Health Organization? What was ICD-10-CM before it was ICD-10-CM? It was ICD-10. We did not originate the ICD-10. It was originated from a whole nother country. When you read the guidelines, you're going to see how WHO, World Health Organization, reshaped it. And then it was called clinical modifications. They added that. That was a United States version. Other countries have a similar product. It's just not called CM. It's a similar product. So, you guys know how people get sick. And people get sick in this country, people get sick in that country, or the United States, or if you're in New York and you're on the south side and you're on the east side, you guys remember what I said. You might have, they only know that there's elderly people that go to this hospital, and most of them are for heart attacks in North Shore. They know that people on this side are most to have shots or gun or trauma at the trauma hospital. They classify it as a trauma hospital because they know what the diagnosis codes are. They know that the North Shore Hospital is not a trauma hospital. It is a hospital. Elderly people go there. 90% of the people in North Shore in that side of New Hyde Park have heart attacks. They're elderly. They may be sickly or XYZ. Go to the south side of Jamaica and no, they got shots and they got, how do we know that, Miss Lambert? Because they keep track of it with the diagnosis code, the ICD-10-CM. So, you guys see how important it is for you guys to know the ICD-10 and know the coding, know where it came from. Now, no, you don't need where it came from when you're working, but when you are testing, they need to understand what you understand. Did she read this material? Does she understand this material? So that's the basis of you guys doing, reading the guidelines. So remember, in your medical insurance billing course, I'm going to put this up here real quick because I've already taken the books down. In your medical insurance billing course, this coding portion, this is just a small coding portion. And you guys know I took this out. I took this out of your class and I put it back in there because a lot of people who didn't take the coding, they still wanted to get the insight of what coding is about. So your medical insurance billing class, these are your medical insurance billing books right here, your workbook and your reading book. They have that small coding portion in there because some of you who are just medical billers who just want to do the medical billing, you still have to have a little bit of insight on what coding is, the 99212s, the office codes, the medicine codes. That will not be here. When you get to your core courses, it will be here. Let me see if I can get you to see that. You guys see that step-by-step book right there? That's your mother book right there. That's how you find out how to code. Okay? That's how you find out how to code. Just make sure that when you start your coding, you have the material that you need. You don't have to get all the books at one time. I would get one book from thrift.com, $5. It's probably not even $5, probably like $4. I one of my students got one for $1.99. That's just for study purposes. Not you guys are not going to take your exam with the old book, okay? You're going to take it with the new book, okay? Now I know I'm over, but I wanted to show you guys the book, and I wanted to make sure you guys got everything that you need. Now, don't forget, this is your next class. This is your next class, okay? We are done with this chat. You guys review this chat as many times as you want to. Again, this is the medical insurance billing. Where is it? This is medical insurance billing course. We are signing off. The next time you see me on here probably be Friday in regards to the other courses. So right now, you guys go ahead and try to get your books. So you want your reading book and you want your workbook. If you can, I would suggest you get your ICD-10, CPT, and your HCPCS book. Okay. I'll see you guys next time. When Miss Lambert, look at your schedule. Look at your schedule. You remember the schedule, right? I'm gonna put it up here only because let me find it, just so you guys can see the schedule at the end. Because there was something on this week 4 that I saw on there that wasn't supposed to be on there. But I'm gonna put it up anyway. This is it right here. So this is Friday. This is Friday class. We just went over 11, 12, and 13. I'm gonna go over 11, 12, and 13 again. I'm hoping you guys have your coding books so we can go over that again. Okay. So that is what we're looking at. That's your schedule. Okay. Today is Monday. We went over this and we also went over this because we got a little bit behind. Okay. So I'm gone. Let's take this down. And I will see you guys next time. We're going to end the stream. See you Friday.